So what is neutral? Let's see where it came from. Root and Weed defined it as neither pronated nor supinated. What kind of definition is that? Then they said, well, we can palpate talonavicular congruity. We're looking at neutral subtalar position, not talonavicular position. And then they said, well, we could take the calcaneus and move it 1/3 into eversion and 2/3 into inversion. We'll find that 2/3, 1/3 position. Again, kind of a lame definition. Where did it originally come from? It was derived from an article written by Dr. Wright in 1964. Subtalar position, where he looked at two subjects standing in relaxed standing foot posture. And that became neutral position. That became what we were all shooting for. Isn't that interesting? When I was in school, the seniors taught the juniors. My senior pulls me aside one day in orthopedics. He says, I'm going to teach you all of podiatric biomechanics in one sentence. I said, what is it? He said, cast them in neutral and make an orthotic. No matter what you measured on your biomechanical exam, it was always cast them in neutral and make an orthotic. I'm going to show you that neutral is not the right position. This neither pronated nor supinated, what is that? That's like asking, where's Chicago? Well, it's neither New York nor Los Angeles. Where is it? That's not a very effective definition. The real problem with neutral is it doesn't address the goals of biomechanical correction. What are our goals? What are we trying to accomplish with a foot orthotic? We would like a foot orthotic that raised the arch so that at mid-stance, the midfoot is stabilized in the sagittal plane so you can have a propulsive gait. We'd like a foot where the forefoot doesn't influence the rear foot. That is, both the forefoot and rear foot are on the ground. We'd like a foot that as you come over it, 60% of your force is under your first metatarsal because it's designed to handle it. We would also like a foot where the first metatarsal phalangeal joint was free to move, allowing you to have a straight ahead propulsive gait. Those are the goals of biomechanics, and neutral position does not accomplish that. So what about neutral position as a reference point for assessing rear foot and forefoot relations? The fact is, you have to use the floor as a frame of reference. The maximal arch height, the maximal arch subtalar stabilization position, lowering the head of the first, puts the forefoot and the rear foot flush on the floor with the maximal amount of supination available at mid-stance. So there's no need to take any measurements. You're going to take that foot and pass weight through it in as close to an ideal gait cycle as that patient can tolerate with their anatomy, giving them the most functional gait cycle that they are currently capable of handling. That's what the mass position is all about. So what's so wrong about how we've been treating patients?